session. Before we move forward, I would like to share a few housekeeping tips. Do not unmute while we are conducting the session. For the session to be seamless, we'll have a short presentation followed by Q&A. So in case you all have any query, kindly leave them in the chat box and we will address the query while we are conducting our Q&A session. So last year when I conducted this session, we all were in middle of the second wave and, trying to deal with it and trying to prepare ourselves for the third wave, hoping that we do not have to encounter it. But yet I think COVID has been a part of our lives. And now, though it has come with a new variant, so let us understand what is Omicron, how can we deal with it, and how as parents, we can do something to give a better future, a better environment to our kids. So for this, allow me to welcome Professor Aanchal Bansal. He's the Group Medical Director, Apollo Hospitals Group, and author of a very famous book, Is Your Child Ready to Face the World? A very good evening, sir.
Priyanka, being a part of your program.
Yeah, and thank you so much. It's a pleasure to have you here again.
Thank you, Aanchal.
So 8 months down the line, when we were here, we were in the Delta variant and discussing about its severity and, mortality rate being high. And we parents, we were all in such a situation, like there was lots of panic around. But then we had such an informative session with you and your tips. I'm sure all the parents here who have been a part of the session again with us would agree that, it helped us sail through the entire variant. So now we would request you to enlighten our participants, our parents about what is Omicron, how is it impacting our children, and what as parents we can do to give them a better environment, and what can we do otherwise also as a society to what we can contribute to the society in the manner of being a good parent.
Thank you ever so much, Aanchal. It's a privilege to be a part of the YI forum again. Who would have thought that we'd be discussing COVID again? But there we go. I'm going to just request for a slide share, please, if you can make me a co-host.
Yeah, sure. Just 1 second. I think you are now.
Yeah, can you see my slides?
Yes, please.
So here we are, an update as of 18th January. So these slides were updated this morning. So I think we've got some current data. It's day 720th of the pandemic. Can you imagine? 720 days. Sadly, we've seen 33 crore cases with 55.5 lakh deaths across the world. And in India, we've had 3.74 crore cases with 4.86 lakh deaths. And I think there's no one who's part of this forum today who has not been touched, lost a family member, lost a relative, a colleague, a co-worker, a friend. So it really has touched all of us. If we look at the numbers over the last week, and this, of course, 1 sec, I think I'm going to slightly tweak this, sorry. Going to go on to a different presentation, sorry.
No worries.
Yeah, can you see?
Yeah, it's visible.
Yeah. Okay. So now looking at the COVID cases. So this is the updated figure. So if we look till yesterday, we'd gone up to 271,000 and, we down to about 238, but then it's early days. So let's wait and see what happens. If we look at, and I tried to look at 238,000 and got the closest figure was 16th April 2021. When we had about 230,000 cases. And I just looked at all our hospitals, and we have 43 hospitals in 15 states where we admit COVID patients. And on 16th April 2021, we had 1,850 inpatients with COVID. That figure today is 800. So definitely less than half. And when we look at need for hospitalization and ICU care, there's a clear correlation with vaccination status. The need for hospitalization has gone down considerably if you're double vaccinated, and the need for ICU care also is much lower if you've been double vaccinated. And all this has changed, when we compare April with now, even though the total number of cases is the same, is because of what has happened in the globe. So now look at United Kingdom, 95% of all cases are due to Omicron. Canada 91%, Australia 90, United States 88, India 75. Now this is data that was analyzed till 10th January. And you have to realize that this is only a percentage of all the cases, because this is expensive testing to do the whole genome analysis. But it gives you a trend. And I'm sure if we look at what's happened over the last 1 week or so, the percentage of Omicron will be way higher. I think every school kid also knows there are variants of interest now and variants of concern. When we say variants of concern, means increased transmissibility, more severe disease or higher death rate, reduced effectiveness of vaccines, and reduced effectiveness of treatment. So let's look at Omicron. Clearly increased transmissibility, no doubt. More severe disease or higher death rate, thankfully, no. Reduced effectiveness of vaccines in getting the infection, yes. But in terms of severe disease or need for hospitalization, no. Reduced effectiveness of treatment, yes. One of the antibody cocktails, this variant is able to dodge, but then we do have a newer variant in terms of the antibody therapy, which of course is not available in India at this point in time. So if you look at the Delta and the Omicron, there are about 32 mutations in the spike protein region itself. Now, the spike protein region is that area which we are very interested in, because that's where all our treatment and vaccination is directed. What is the difference clinically? So sore throat, very common. And if you look at loss of silent teeth, well, that's really a Delta variant or one of the earlier variant manifestations. You don't really see this with Omicron. Fever, yes. Cough, yes. And then you get a variety of symptoms: headache, loss of appetite, body aches, nausea, and all. And you don't really get any significant breathlessness in the vast majority of cases with Omicron. To put it simply, transmissibility is really high with Omicron compared to Delta. Symptoms are lower than Delta. Respiratory distress is way lower. Risk of hospitalization is way lower. Now, of course, people keep talking about the Spanish flu. Yes, there were 3 waves. And as you can see, the second wave was way higher than the first wave, and the third wave was lower than the second wave, the peak. And then, of course, it went off. Of course, there was no vaccination at that point in time. So we can't really extrapolate. But yes, the only relevance here, I would say, is that multiple waves. And in many countries, we've seen the 4th wave. In India, we're seeing the 3rd wave. Now, prediction versus reality. A lot of work was done. We got Hopkins, Princeton, CDEP come out with predictions. And I'm just going to show you what they said about the 2nd wave. They got it pretty inaccurate. According to them, the number of cases would have become like 12 crores or something. The reality had 2.5. Deaths were supposed to be like 4.9 lakhs. Well, we had 2.5. And so there were lots of, what should I say, the prediction didn't really go right when you look at all this. But then we also had an Indian model, and I think we need to be proud of this. This model was developed by IIT Kanpur. And their model was pretty accurate. So if you look at actual data versus the model, it is really as accurate as it can be, from predicting the peak to how it went down. And this is how it panned out. So this is the Sutra model. A lot was said about the mortality, but I just like you to just look at the total number of deaths per million population. India was the lowest. Brazil went up to 2944. US was 2500 plus, France 1800, UK 2200, India was 356. So we did reasonably well. Now look at the Sutra model for prediction now, and the Sutra model is like end of January, the peak, and then things start to get better in Feb. By end of Feb, we should be out of this wave. There's another very elegant model that's been developed by the Indian Institute of Science and ISI Bangalore, and you can look at for all of those within the group who are into math, you can see the complexity of the equation here for you. And this is what they predict. And here what they've done is if 100% of the population exposed is susceptible, 60% susceptible, 30% susceptible. And of course, they also give out the daily cases. So according to this, again, somewhere in early Feb, we peak could be also end of January, and then by March we should be good. So that's what it's looking like. Do remember that we have the South African model to look at. In South Africa, the total number of people vaccinated were about 30%. In India, we have way higher numbers vaccinated. So there it took about 5 weeks. So hopefully it should take that much or less in India. Now, what is the future? I'm sure everyone out here is very interested in what the future is going to be. So let me give you an example of the influenza virus. Now, the influenza virus has a tendency to mutate. And what we see is an antigenic drift and an antigenic shift. So what happens with an antigenic drift, which happens annually, is that the predominant variant of influenza varies every year. And based on what is circulating more in the world, the WHO gives out instructions or advice to manufacturers to create a vaccine, which then gets rolled out in September or so. And every year the vaccine is different, and that's based on the antigenic drift. But from time to time, you get an antigenic shift. So some of us would remember the 2009 antigenic shift, where H1N1 or swine flu came in. So we got a totally different type of influenza virus in there. It created a pandemic of sorts. So do we expect that to happen with the SARS-CoV-2 virus? Yes, in all probability, that's going to happen. It's going to continue to mutate, and we're going to have different variants. Sometimes we'll have variants of interest. We hope we don't get variants of concern, because those are the ones that produce more devastation. Remember, the WHO chose the Greek alphabet. The Greek alphabet has 26 letters. So we're going to see a fair number of variants, and each time a new variant comes, it's going to get one of these Greek alphabet-based name. So we've had 5 variants of concern so far, and we've had 8 variants of interest. So we've already had 13, and there are 26 letters in the alphabet. What can each one of us do? Well, we need to wash our hands. I think all of us here are pretty particular about that: hand washing, use of sanitizer. We need to make sure that we wear a mask, and the recommendation for the mask is a tightly fitting N95, not a cloth, not a surgical, not one of those fancy designer masks that you get, but we have to go back to the plain and simple N95. Social distancing, people have tended to forget now, and we need to remind ourselves 6 feet. Of course, it remains to be highlighted again and again that we need to eat nutritious food and remain well hydrated, because that's good for the body in general to provide protection against any sort of infection. Now let's turn to the most important aspect in terms of what's in our hands. And I shared with you data that with vaccination, the risk of hospitalization, ICU care, and death goes down. And now if we look at vaccination figures over the last few days from 11th to 17th, quite impressive. I mean, they go down on a Sunday, but if you look at, 79 lakh people, 89 lakh people, these are huge numbers. And I think the government needs to be applauded. I think the public and the private sector coming together to be able to vaccinate such huge populations is truly remarkable. This is unprecedented, and you don't get such examples in the globe. Let me compare with the United States. The United States, if we look at how much have they vaccinated, they of course started in December. We started in Jan last year. So they've given a total number of 52 crore vaccines. We've done 3 times of that, 158 crores. I think what we've done in the last few days, in fact, it's in the last 15 days that vaccination started between age of 15 to 18 for teenagers, and we've administered 3.59 crore vaccines. And just to give you a sense, that's more than the population of Sweden, Norway, Finland, Denmark, and Greece put together in 15 days. So we have a machinery that's really working well. In terms of vaccination overall, if you compare with some of the other countries, 5 times of Brazil, UK, France, very, very impressive numbers. Last night at the World Economic Forum meeting, the Prime Minister mentioned that India is the pharmacy to the world, and we have become the world's 3rd largest pharma producer. As part of vaccine Maytree, India sent out 68 million doses to 97 countries, and 70% of the global COVID vaccines will be manufactured out of India. And that's something, again, that we need to be proud of. We organized a conference last year in February, which for the Global Association of Physicians of Indian Origin, that brings together 1.3 million doctors of Indian origin on one platform across 53 countries. And the Prime Minister sent us a message, and I'm going to quote here. A worldview is anchored in our ethos of Sarve Bhavantu Sukhina, Sarve Santu Nirmaya, which really means may everyone be at peace and may no one suffer from illness. And if one thing that all of us have learned from COVID is that cases emerging in South Africa, everybody now has Omicron everywhere in the world. So what we need to realize is that we are one large family. The world is one family, Vasudhaiva Kutumbakam. And we really do need to think about what happens across the globe has an impact in India. Thank you very much. I'm going to stop there, and I'm going to be very happy to answer any questions that you might have.
Thank you so much, Doctor. That was really informative in terms of, and yes, India just marked the 1st year of the vaccination drive, and we all should be very proud of it.
Right.
So, yeah. So we're starting with the Q&A session, and if anyone has any questions, they can drop in the chat box. Meanwhile, Doctor, so we had a word with a lot of parents, and we have few set of questions which are commonly asked amongst parents, specifically related to Omicron. So like in Delta, we saw last year that there were a lot of GIs, like apart from cough and cold, so that even if any child had a stomach bug or something, we could relate it to COVID. So are the cases similar when it comes now, or what symptoms do we need to look into? Is it more like if a child has cough and cold, of course, we relate it to COVID, but then again, are you witnessing any cases wherein there are a lot of stomach issues and everything, the children complaining of it and then getting a fever and then eventually getting tested and being COVID positive?
So the last time around, we saw more GI manifestation. This time around, it's like typical fever, itch in the throat, pain, a bit of cough, running nose. Some kids get nausea, a few get diarrhea, body aches, weakness. Fever typically increases up to 103, continues for till about day 3. Day 4, the child starts to feel a lot better. The fever goes, and by day 5, most children are well. And a very large chunk of children have no symptoms and are detected because everyone else in the family is positive and they got tested. That's what we're seeing.
Okay. And if a child has a symptom and no one else in the family has any symptom, still do we relate that to COVID, or it could be some other, because there are a lot of things because of the bad air quality and everything daily.
Yeah, I mean, one will have to sort of do this on a case-to-case basis. Now, if one thing I can tell you, if 1 or 2 people in the family have it, then everybody's going to get it with this variant. It's not like last time that a husband had it and wife didn't. This time you have exceptions that one person escapes, but by and large, the whole family is getting it. So if you have just the child there and no one else, then perhaps it's not Omicron. And, of course, kids do get other common, illnesses that includes viral gastroenteritis and so on and so forth. But we also have to take into account that kids aren't really going out. There is no school, there are lots of restrictions going on. So if they get something, the first thing that comes to mind is it COVID?
Right. And what is the incubation period for Omicron? Like for Delta, we knew that, you can get the symptoms even after 7 days or within like 7 to 10 days. But what is it for Omicron? Like when do we see that, we get those symptoms?
So the average is about 5.7 days, the incubation period. People are infective the day before they have symptoms. And I think that's where the problem is. So you could actually be together having a nice little Lohri party, just family. I'm not talking about a party here. I know everybody in this group is very sensible, so nobody had a party. But, it's just family members together for Lohri, and everyone was fine. And the next evening, 2 people develop an itch in their throat and fever. The next morning they test positive. So everybody then starts thinking, do I have COVID? 2 days later, you test everyone. And well, 60-70% of people who were there at the Lohri party have it. That's what we're seeing. And that's why it's spreading so much, because people have zero symptoms. You cannot blame them. You cannot blame someone who has zero symptoms, absolutely well, doesn't know he's carrying it, and he's spreading it, and it's infectious, and a day later or 2 days later turns positive. And that's the reason why we're getting the kind of spread that we are.
Okay. And what is the percentage chance of reinfection? How many cases have you seen that kids or the family members or anyone who got exposed to the Delta variant and now they're again coming back with the Omicron variant reinfection?
So with Alpha and Delta, if you had one of them, then you didn't get reinfected in any significant proportion. So we were very happy, oh, you got it once, and kind of, things are fine. Omicron has zero respect for Delta or Alpha. I said, okay, man, I see a human being and let me go make a home there. Zero respect for previous infection. But definitely, if you've been infected, your body does mount an immune response that is stronger. So you don't have the kind of symptoms you had the first time around. So you do a lot better. But unfortunately, really unfortunately, being vaccinated or having had it is no protection from getting it again. But very importantly, it keeps you out of hospital, it keeps you out of ICU, and it saves your life. If you had it before or you're vaccinated completely. You've got some kids coming on board, right?
Are you kids?
And in this wave, particularly, we have seen, especially with kids, this we had because we talked to so many parents, that no medications have been prescribed in terms of vitamin C and zinc, like in last time. So it was like, even if one of the family member had COVID or something, so we were advised to at least start with that kind of medication for kids, start with multivitamins or something. But this time around, we have seen that this hasn't been prescribed by the pediatricians. Any specific reason to it?
Yeah, I mean, frankly, we know a lot.
You are on.
So, this time our understanding of the pathophysiology of the virus is a bit better. So everybody's very judicious. Okay, paracetamol, sure. If you're having fever, if you're having body aches, if you got a throat that's really bothering you, something to soothe the throat. Nothing like adrak and honey and warm water. Honestly, it's really helping. Vitamins have no role to play. We're not giving any zinc. Obviously, we're not giving any ivermectin or any of the other stuff, which of course, as you know, has been studied extensively and found not to be of any great use. We're also not testing with any blood tests. Last time around, D-dimer and CRP and what have you, and IL-6 levels, we're not doing that. Chest X-rays are not being ordered. And of course, no CT scans, because anyway, even last time around, we were very judicious because we don't want to expose children to radiation. So this time is totally out.
Okay. And so this is and if someone has had COVID, like a kid in the family, are there some multivitamins prescribed post for the recovery of the kid?
Really, I don't think it has any impact on recovery. Whatever vitamins the kid is on should continue.
Okay, nothing specific required post care for any kid.
No.
We had one more question, because last time MISC was a lot, in the talks, and So this variant, we haven't seen it much. So are there any long COVID symptoms seen in kids? Like there's so many kids who complain of leg pain even after a month or so after, they have gotten out of COVID. So are there any
So a lot, like you rightly said, Aanchal, there was a lot of talk about MISC. In fact, it was only about 1% of all the kids who got COVID got MISC, but it got a lot of eyeballs, lots of media attention. Well, at this point in time, it's early days in terms of long COVID because, this variant hasn't been around. But given, what it's doing and how the body is sort of responding to it, I'd be surprised if it has any long-term impact. And Delta was a totally different, variant. So when you make a pretty quick, swift recovery with Omicron and you get a lot better in 5-7 days, it's extremely unlikely that we're going to see anything substantive. But like I said, it's a bit early because Omicron hasn't been around for that long.
And since we've heard that in this particular variant, the fever might spike to 103 degrees. So when is it that we raise that red flag and, ring the bell and that, no, we need to consult a pediatrician for our kid, or this is getting on a worsened side. So when do we do that as a parent? When do we get to know that?
I think what advice I give, and, that's what I put out in a video because there were lots of panicky parents who were calling. So basically, every child is different. What I've given are general sort of guidelines, but it's important to be in touch with a pediatrician who can really walk you through, okay, is your child at a greater risk of getting something more? Are there any medical factors of note that need to be considered, and so on and so forth? All it takes is a 10-minute consultation virtually, and that will put your mind at rest, and the doctor will go through the do's and don'ts, and okay, paracetamol, if the fever is not coming down with paracetamol, what next, and so on and so forth. And once you've had that conversation, your mind will be at rest and you know how to deal with the situation as it pans over the next 3 to 5 days.
We have a question here that is there any skin related problem for children seen in COVID, particularly this time?
I haven't seen anything to that effect. I mean, of course, there might be rare manifestations, but it's like not common.
And considering there are kids who have this problem of febrile seizure, and the kids were asthmatic, and because this mainly now is into the upper respiratory tract. So and the fever spikes to 103, and for the kids who have this history of febrile seizure, so is it a variant of concern for them, particularly for their parents, to be like very cautious? And because as parents, because I am a mom myself, so at times you feel your child is slightly cranky, but child doesn't have fever, you still feel like, giving that crocin, that it will at least soothe your child.
Yeah, so you see, crocin also does work like a painkiller, other than it being an antipyretic to bring the temperature down. So if a child having body aches, it'll help. Now, any child with febrile seizures, you want to treat the fever aggressively. So please, by all means, follow the standard practice of bringing the fever down, and perhaps a prophylactic medication if needed. But other than that, like I said, it depends on a case-to-case basis. In terms of kids who have asthma or wheezing, fortunately, it doesn't really go into the respiratory tract. It likes the throat and the, so that's the area where it produces more symptoms.
And are there any particular symptoms seen in kids? Like if we've had few kids who have just had fever for a day, and after that it was nothing, and then suddenly after 2 or 3 days they develop that dry cough or chest congestion. So how is it relatable?
It is. Sometimes you get that manifestation as well, where you get fever and then a couple of days you get something.
So it is very normal in the kids to have it like that.
Yeah, you can have that.
Okay. And Dr. Sibal, coming to schools, considering that we all are in Delhi and Delhi government has not opened the schools, especially for primary and pre-primary kids. But then we see kids from Gurgaon, Noida, wherein the different governments and schools have been opened. So as parents, we feel that, because the physical development of the child has been compromised over 2 years. So even if our child wants to go for like once a week to the school or twice a week to the school, why not send? Because keeping them indoors has also weakened their immunity equally. So what is your suggestion or take on it? Because I'm sure her parents would agree with me, because we're in a dilemma whether to send the child to the school or not.
Well,
So
I think one obviously in, sorry, while one has to do exactly what the authorities tell us, but I believe the way this is going and the kind of infectivity that we have, and so many people would have got infected, that I think keeping anything closed after a while will not really be needed. Most people would have got some kind of an infection and would have some immunity. So I personally am pretty optimistic about schools opening up and life coming back to normal by March.
okay. So you suggest even like a 2 or 3 year old kid, like for nursery also, we shouldn't think, because it's not airborne, but then yes, everyone in the family is infected, whether the last variant or this variant, and they have specific type of antibodies in them which can fight in for if they have any.
No, you're right about that's how children get immunity. They get exposed to all kind of infections when they go to nursery and play school and so on and so forth. So they need to get back into that sort of routine. And if they do get exposed to COVID, then we're going to have to start, see if it's Omicron that persists, then we're going to have to start looking at it and thinking like we do for common cold, just like parents do. Now, if it gets downgraded to a common cold, and I hope and pray that it does, then of course life would be very different, wouldn't it? I mean, you get fever, you get a cold, you get a cough, you move on in life.
Right. And also there was a question related to vaccination, of course, because India has marked 1 year, and worldwide also it's been going on, and specifically seen with this variant. So even in the countries where the boosters were given in India, they haven't been to our age group or the elderly yet. So how are vaccinations helping in combating it? Because where this variant, any of the variant of COVID has to play its role, vaccines are not saving us from getting infected. And anyhow, this variant was mild, so the need of hospitalization, was it less because the variant was mild, or was it because we were immunized to it?
So I think it's both. But definitely what we've seen, even with the Delta variant, we saw, and we looked at, about 30,000 Apollo hospital members of staff who were vaccinated, and we looked at breakthrough infection, and we looked at, the hospitalization rates in those who were vaccinated with next to nothing, even with Delta. So definitely, of course, we all know that, there are exceptions, and there were people who were double vaccinated and still got Delta and went into the ICU and got into a lot of trouble. But by and large, if you look at the large community data, vaccination did prevent hospitalization, need for ICU care, ventilation. And we are seeing that with Omicron also. The need for hospitalization, ICU care, ventilation definitely is lower if you're vaccinated, and the risk of dying is much, much, much lower.
Okay.
Yes, Omicron is milder in terms of its clinical manifestations compared to Delta, but the fact that you're vaccinated does give you one added layer of protection. Now coming to the third dose, well, clearly the authorities are expanding, and you've heard that from March, kids between 12 and 14 will start getting it, and then it'll be younger kids. And at the same time, I think just like we had with the first year, initially in the first 1 month, it was for healthcare workers and all, and then it opened to older than 60, then comorbidities, then younger, and so on. So that's going to happen again. That's going to pan out because the vaccine manufacturing ability has gone up. So we will see that the vaccination will become, the third dose will become open to more and more people in the coming weeks.
Okay. And any COVID protocols to be followed within the family when everyone is infected, considering it is very difficult to mask ourselves up?
Just forget about it. Everybody's got it. So just relax. Just this, when everybody in the house has got it, then there's really nothing to, who's to be protected.
No, it is because of the persistent cough, which I think adults, we've seen the last variant also, and this time also, it takes a while to settle, like good 4 to 6 weeks.
Yeah, this doesn't really worry us too much, because as long as the virus is dead and gone, it doesn't matter. So, 7 days later with Omicron, you're pretty good. Okay. The cough might persist. Yeah. And, if somebody's got asthma or wheezing, their cough will take much longer.
Yeah. So it doesn't reinfect the child again. Okay. Taking few questions from the chat box. How dangerous is to the children as they are not vaccinated? Is this virus dangerous for those who are not, so basically,
I think we've kind of answered that. None of the kids are vaccinated. So I answered that question about what's happening in kids, because under 15, everybody's unvaccinated in India.
and this is, I think, for sure for some teenager group, that do we have to take the same precautions for exercising and workout for children like we do for adults?
Well, I think we don't need to overdo it, but once the child's fine and you can do some basic exercising, but don't really need to get into heavy exercising. And again, it's relatively new, so we don't know that much. We knew that with Delta, that's a bit of a problem. So the middle path would make sense.
Okay. And here we have one more question. How can we identify symptoms in person having respiratory issue like asthmatic and allergies like it has happened in many families, because so basically the kids are not stepping out, but the adults are, the men of the family or the women who are working, they have to go out, and some of them, they already have those allergy issues considering the weather.
Yeah, you can't clinically distinguish. You have to test. There is no way a doctor can tell you this is allergy, or this is related to common cold, or this is influenza, or this is Omicron. You have to test. You can't tell clinically.
Okay. And any particular diet the kids should follow? Like the basic problem is, I think most of the parents, they also had the same thing, that because when a child is down, the child doesn't eat anything. So whatever the child demands, the mother or father has
It's
to.
fine. I mean, the first 3 to 5 days, the kid is really not going to be very interested in food, is going to be pretty fussy. So that's okay. That's acceptable. That's the norm. But of course, a good balanced nutritious diet with a fair amount of hydration is something that we encourage. We encourage that for prevention of a variety of illnesses. So that's really the norm. And the child will not eat for the first few days, and that's okay. And whatever the child is keen to eat, let the child have that.
Okay. And so far, because it is not very, this variant is not very old in India and otherwise also. So any particular symptoms or after effects seen in the kids who have just developed fever, after like a week, 10 days?
Nothing really as of now, but like you rightly said, it's early days. So let's see how things pan out, but nothing that's kind of standing out.
Okay. And like recently we saw that hospitalization in US has jumped up for kids, like for different age groups, it is different. So is it like India is going to see the same pattern?
Well, I don't think it's happened in very many countries, and it all depends on the absolute number. So if so many thousands are going to get infected, then there will be a proportion of children also who will be infected. And out of that group of children, some children will need admission, and it could be because they have underlying other conditions as well. So I think if you remember, there was this whole talk about the second wave and kids because they're unvaccinated. Did we see that? No. So I think it's behaving in a very mild fashion, which I think is really quite reassuring.
And so many people, they say what we hear that, might be this is the endemic. Like obviously endemic doesn't mean it's going to end. It is like the virus will find its way, just like dengue, typhoid, malaria are a part of our lifestyle. Again, COVID is also
yeah, but it's going to go in that direction in all probability. It's not going to get eradicated. So it learned to change, and it learned to sort of become a part of the environment, and it'll become endemic, and we will learn, how to live with it. So cohabitation is what we have to prepare ourselves for.
So Aanchal, I just wanted to ask one question. I had actually this, doctor, this is not for children, but generally for adults. There's a lot of different views in terms of what the booster dose should be, right? Whether it should be the same vaccine or the different vaccines. While the government of India has given a mandate, should be the same vaccine, but globally there is differing studies. So any takes on that?
Well, there are lots of interesting studies about heterologous versus homologous. I think for India, the government is very, very clear on how it is to be given, and I think we'll stick with that. They looked at data from across the globe and arrived at that. So it's the same dose. It's the same vaccine that has been recommended for the third dose.
Okay, great. Thank you. I think we'll give a last chance to the audience to ask any further questions or text in the chat box, Aanchal, and then we can close the Q&A, maybe I think after that.
Yes, please. If anyone has any questions, they can just put it in the chat box and we'll be happy to take them. Meanwhile, I was going through, there was a question that what are the preventive measures for our kid not to have it, like if someone else in the family has it, apart from
Mask up, that's the only thing, hand washing, spacing and masking. And that will also apply when they go to school.
There's a question from a mother. When classroom teaching starts, how long can the kids wear mask in the class?
But
Because
they're going to have to wear the mask at all times when they're outside. Each one of us, because we don't know what's going to happen next with another variant. So I think masks, hand washing and spacing is here to stay. COVID avoidance behavior is going to have to become a part of our lives.
so even a kid wearing a mask for 5-6 hours, it is
fine.
fine. It is fine.
I mean, just it requires a bit of training and patience because they get irritated.
Yeah.
But I guess it's a question of conditioning.
And how about the kids who are like more than 2 years of age group, where they don't mask up, and considering the weather, you just cannot every time, wash their hands, and they have to put everything in the mouth and then sanitize.
I know it's a tricky one. I mean, it's really hard with the little ones. Of course, sanitizer is something that we can use, and it's cold, so you can't keep washing your hands with soap and water. It's a tricky one, but I don't think we have any other solution really.
Okay. And what is the total period? Like last year, the quarantine period was good 14 days.
It's
and
7
after
days now. 7 days from the time you become positive and no need to retest.
No need to retest.
Yes,
Okay.
and you have to have no fever for 3 consecutive days.
Okay.
A vast majority of people are much better by day 5, day 6.
Okay. And we have a question, that is headache a post-COVID symptom for adults?
Oh, well, some kids do complain of headache that lasts for a while.
That lasts for a while. So there's no medication required to it. It goes off.
You just have a painkiller if it's bothering you.
Okay. And I think, how can we protect small babies less than 1 year from COVID? I think
It's pretty hard. It's pretty hard because you can't mask them. So everybody around them have to be masked properly.
Right. So I think we've covered a fair list of questions. There's a bit of repetition now happening. So any closing comments, doctor, in terms of generally?
Well, I think in that, listen, this virus is very smart, and it's going to survive, and it's going to mutate, and it's going to come up with newer versions and newer variants of interest. And I hope not, but variants of concerns always a possibility. We need to accept the fact that life pre-COVID, post-COVID is going to be different. We have to learn to accept that hand washing, and look at Southeast Asia. You remember 5 years ago, everyone used to wear a mask anywhere at every airport there, shopping malls. It's a part of the culture there in Japan and in Korea. I think we're going to have to make it a part of our culture as well to mask up, and social distancing and hand washing. And of course, it's going to take time for us to get used to it. But I think the virus has taught us 720 days and counting. So we might as well accept the fact that we're going to have to change the way we conduct ourselves socially.
Thank you so much.
Right. Aanchal, do you want to close the session? Yeah.
Yes, I will. So doctor, on behalf of 𝗖𝗍, first of all, I would like to thank you for taking out time at such a short notice for us. And I'm sure this time we didn't had much questions, because last year we had such an extensive session wherein we covered so many things, and hopefully this virus doesn't have much to talk about. And we just hope that in the coming future, we do not have variant of concerns for everyone around. So some of the key takeaways which I could understand from this entire conversation, which I would like to just post across, is that we have to make sure that our child abides by the COVID avoidance behavior, and that can start if we started as adults, masking ourselves and maintaining that social distance. And I think we all should be cautious and not panic, because our kids are resilient and they will come out of it. We as parents, I think we panic a lot. So thank you, doctor, for such an informative session, and we all look forward to meet you again, probably on a different note in the coming time.
All the best. Thank you very much. Stay safe.
Thank you, Dr. Sibal. It was a very insightful session. I think the only key takeaway, apart from what Aanchal said, if this can become like a common code where you learn to live with it, I think that's probably going to be like a good end goal for all of us, that if it becomes something similar to that, you can't ignore COVID, but we'll learn to live with it, basically.
Thank you very much. Bye-bye.
Thank you. Bye-bye. Okay. Thank you everyone for joining in the session. Thank you. Thank you, Aanchal, for hosting this and for the great Q&A. Thank you.